COVID cases, COVID-19
rising number of COVID cases.
And I want to start by
cases.
acknowledging how tired.
And I want to start by acknowledging how tired
you are,
worried,
I know
and
how you're
frustrated
feeling.
I know you are.
For many of you, this
I know
will
how
be
you're
the
feeling.
first or even the second
Many
Christmas.
of you, this will be the
Where you look
first or even
across
the
the
second
table,
Christmas.
be an empty kitchen chair.
Where you
there.
look across the table, be an
Tens
empty
of
kitchen
millions
chair
have
there.
gotten sick.
Tens
We've
of
all
millions have gotten
experienced
sick.
upheaval in our lives.
We've all experienced
But while
upheaval in
COVID
our
has
lives.
been a tough
But while
adversary,
COVID has been, we've shown that
a
we're
tough
tougher.
adversary.
We've shown
Tougher
that we're
because
tougher.
we have the power of science.
Tougher
and
because we have the
vaccines
power of
that prevent
science
illness
and
and save
vaccines
lives.
that prevent
And tougher
illness and
because of
save
our
lives.
resolve, so that
And
let me
tougher
answer
because
some
of our
questions
resolve, so that
that lay
let me answer some questions
out the steps
that
the Vice
lay
President and I are taking.
out the steps
Prepare
the
for the
Vice
rising
President and I
number
are
of
taking.
cases. Experts
Prepare
tell
for
us
the rising number
we
of
can
cases.
expect in the
Experts
weeks
tell
ahead.
us we
First,
can expect in the weeks ahead.
How concerned
First,
should you be about Omicron?
How concerned
which is
should
now
you be
the
about
dominant
Omicron,
variant in this country,
which
and
is
it
now
happened
the
so quickly?
dominant variant in this country? And it
The
happens
answer
so
is
quickly.
straightforward.
If you're
The answer
not
is
fully
straightforward.
vaccinated, if you're
You have
not
good
fully
reason to be
vaccinated,
concerned.
you have good
You're at a
reason
high
to
risk
be
of getting
concerned.
sick.
You're at
If
a
you
high
get
risk
sick,
of
you're
getting
likely
sick.
to spread it to others,
If you get
including
sick,
friends
you're
and
likely
family.
to spread it to others.
And the
including
unvaccinated
friends
have
and
a
family.
significantly higher risk of
And
ending
the
up in a
unvaccinated
hospital.
have a significantly higher
Or
risk
even
of ending
dying.
up in a hospital.
Almost
Or
everyone
even
who has
dying.
died from COVID-19
Almost
in the past
everyone
many
who has
months
died from
has
COVID-19
been
in the past many months
unvaccinated.
has been
Unvaccinated.
unvaccinated. But if you're among the
Unvaccinated.
majority of Americans
But if
who
you're
are
among-
fully
if you're
vaccinated,
among the majority of
and
Americans
especially if
who
you've
are
gotten the
fully
booster
vaccinated,
shot, that third
and
shot,
especially if you've gotten the
you're
booster
much-
shot,
you have
that
much,
third
much
shot,
less reason to worry.
you
You have much
you
less
have a
reason
high
to
degree
worry.
of protection
You
against
have
severe
a high
illness.
degree of protection
Because
against
Omicron
severe
spreads
illness.
so easily.
Because Omicron
We'll see some
spreads so
fully
easily,
vaccinated people get COVID.
we'll see some fully vaccinated
Potentially in
people
large
get
numbers.
COVID. There'll be
Potentially
positive
in large
cases in every
numbers.
office.
There'll be
Even here in the
positive
White
cases
House,
in every
among
office.
the among the
Even here in the White
vaccinated,
House,
among the
vaccinated.
among the vaccinated,
From
among
Omicron.
the vaccinated.
But
These
from
cases
Omicron.
are highly unlikely to
But
lead to
these
serious
cases
illness.
are highly unlikely to
Vaccinated
lead to serious
people who get
illness.
COVID,
Vaccinated
ill,
people who get
but they're
COVID
protected
may get ill
from severe illness
they're
and
protected
death.
from
That's
severe
why you should
illness
still
and death.
remain vigilant.
That's why you
According
should
to our
still
doctors,
remain vigilant.
even if you're
According
fully
to our
vaccinated,
doctors,
you should wear a mask.
Even if you're fully
When
vaccinated, you
indoors
should wear a
in public
mask.
settings. When
Wearing a
indoors
mask
and in public
provides extra
settings.
protection for you.
Wearing a
and those
mask
around you.
provides
And I
extra
know
protection
some
for you
Americans
and
are
those
wondering
around you. And I know
if you can
some
safely
Americans are
celebrate
wondering
the holidays with your
if you
family
can
and friends.
safely celebrate the
The answer
holidays
is
with your
yes,
family
you
and
can.
friends. The answer is
If
yes,
you and those
can.
you celebrate with are
If
vaccinated,
you and those you celebrate
particularly
with
if you've
are
gotten the booster
vaccinated,
shot,
particularly if
you
you've
are
gotten the
vaccinated,
booster shot,
and follow the
if you
precautions
are
that we
vaccinated,
all know well,
and follow the
you should
precautions
feel
that we
comfortable
all know
celebrating
well.
Christmas and the
You
holidays.
should feel comfortable
as you
celebrating
planned.
Christmas and the holidays.
You know,
as
you've done the
planned.
right thing.
You know, you've
enjoy
done
the
the right
holiday
thing.
season.
You can enjoy
And
the
thanks
holiday
to the
season.
progress on vaccinations this
And
fall.
thanks to the progress
We've
on
gone from
vaccinations
nearly
this
90
fall,
million adults in
we've gone
July
from
who had
nearly
not even
90
started
million
the
adults in
vaccination
July who
process
had not even
to
started
fewer
the
than
vaccination
40 million
process.
today.
Still
Fewer
too
than
many.
40 million today.
Down from 90
Still
to
too
40.
many.
Down
All
from
these
90 to
people who have
40.
not been vaccinated.
All these people
You
who
have an
not been
obligation
vaccinated.
to yourselves.
You have an
to your
obligation
family,
to
and quite
yourselves.
frankly, I know
to
I
your
get
family,
criticized
and
for
quite
this, to your
frankly,
country.
I know I get criticized for
Get
this, to your
vaccinated
country.
now. It's free.
Get
It's
vaccinated now.
convenient.
It's free. I promise you,
It's
it saves
convenient.
lives. I promise you, it
And
saves
I honest to God
lives.
believe it's your patriotic duty.
And I honest to God believe it's your
Another
patriotic
question
duty.
folks are asking is,
Another question.
what can you do to
folks
make
are asking
yourself and
is,
your family
what
feel
can
safer
you do to
and be
make
safer?
yourself and your family
The
feel
answer's
safer
simple.
and be safer?
Get your booster
The
shot.
answer's simple.
Wear a mask.
Get your booster shot.
Our doctors
Wear
have
a
made
mask.
it clear. Booster shots provide
Our
the
doctors have
strongest
made
of
it clear.
protections.
Booster shots
Unfortunately,
provide the
we
strongest
still
of
have
protections.
tens of millions
Unfortunately,
of people who are
we
eligible
still
for
have
the booster
tens
shot,
of millions of people
but have
who are
not yet
eligible
gotten
for
the
the gotten the
booster
first
shot.
two shots,
but have not yet
but have
gotten,
not gotten the
booster.
first two shots,
Folks,
but have not gotten the booster.
booster shots are free
Folks,
and
booster
widely
shots
available.
are free
and
over 60
widely
million
available.
Americans,
Over 60
including
million Americans,
62% of eligible seniors,
including
our most
62%
vulnerable
of
group,
eligible seniors,
have gotten their booster
our most
shots.
vulnerable group.
I got
have
my
gotten their
booster
booster
shot.
shots. As
I
soon as
got
they
my
were
booster
available.
shot.
And just the
As
other
soon
day,
as they were
former President
available.
Trump announced he
And
had
just the
gotten
other
his
day,
booster
former
shot.
President Trump announced he had gotten his
Maybe one of the
booster
few
shot.
things he and I agree on. Maybe one of the few things he and
People
I
with
agree
booster
on.
shots are highly protected.
People with booster
booster shots
Join
are
me.
highly
Join us.
protected.
It's been
Join
6
me.
months or
Join
more
us.
since my second shot.
It's been 6 months or more
If it's
since
been
my
6
second
months or
shot.
more from your second shot when I
If
got
it's
my
been
booster,
6 months or
you can
more
get
from your
yours
second
today.
shot
If
when
you've
I
been
got
6
my
months
booster,
or more
you can
since
get
your
yours
second
today.
shot. If you've been 6 months or more since
Another
your
question
second
that folks
shot.
are asking,
Another
is,
question
are we
folks
going
are
back
asking
to March 2020?
is,
Not
are
this
we
last
going
March
back to March
2021,
2020? Not this last
but
March 2021.
March 2020, when the
But
pandemic first
March
hit.
2020.
That's
when
what
the
I keep
pandemic
getting
first
asked.
hit.
The answer is absolutely
That's what I
no.
keep getting asked. The answer
No.
is absolutely
no.
Here are three big
No.
differences between then and
Here
now.
are three big differences between then
One,
and now.
Number one, first one, more than
Number one, first
200
one.
million Americans
More
have been
than
fully vaccinated.
200 million
In
Americans
March,
have been fully vaccinated.
2020.
In March, no one was fully
2020.
vaccinated. No one was fully
What
vaccinated.
that means is today, what that
Cases-
means is
a case
today,
of COVID-19 for fully
cases-
vaccinated
a case of
and boosted person
COVID-19 for
will
fully
most likely
vaccinated
mean
and
no
boosted
symptoms,
person,
or
or
most
mild
likely
ones
mean
similar
no
to the
symptoms,
common
or
respiratory
mild
virus.
ones similar to the common
Over
respiratory
200
viruses.
million Americans.
Over
Should have the peace of
200
mind
million
that they
Americans
did not have in
should
March
have
of
the peace of mind
2020
that they did not have
are
in March of
protected
2020.
from
They're
hospitalization.
protected.
They're protected from
From
death.
hospitalization, and they're
Second
protected from
point.
death.
We're prepared
Second
today
point.
for what's coming. We're
In
prepared
March of
today for what's
2020,
coming. We were not ready.
In March of 2020,
Today we were not ready.
We stockpiled
Today
enough
we
gowns,
stockpiled enough.
masks,
We
and
stockpiled
ventilators
enough gowns
to deal with the surge
masks,
of
and ventilators.
hospitalizations among the
To deal with the
unvaccinated.
surge of hospitalizations among
Today
the
we're ready.
unvaccinated. And as I'll
Today we're
explain
ready.
in a few minutes, we're going to
And
be
as I'll
reinforcing
explain in
our
a few
hospitals.
minutes,
We're
helping
going to be reinforcing our
Number
hospitals,
three.
helping them. We know a lot more today.
Number three,
than we did
we
back
know a
in
lot
March of
more today
2020. Than we did
For
back in
example,
March of 2020.
last year,
For
we
example,
thought the only way to keep your
last
children
year,
safe was to
we
close
thought the
your-
only way to
close our
keep your
schools.
children safe was to
Today
close
we
your-
know
close
more
our
and we have
schools.
more resources to
Today
keep
we
those
know
schools
more and
open.
we have more resources to keep
We
those
can-
schools
you can
open.
get 5 to 11-year-olds
You can-
vaccinated.
You can get 5
Tool
to
we didn't have
11-year-olds
until last
vaccinated.
month.
Today,
Today, we didn't have until
we don't
last
have to
month.
shut down schools
Today,
because of the case of COVID-19.
we don't have to shut down schools.
Now,
because
if a
of the
student
case of
tests positive,
COVID-19.
other students can take
Now, if
the
a student
test
tests
and
positive,
stay in
other
the
students
classroom
can
if
take
they're
the
not
test
infected,
and stay in the
rather than
classroom
closing
if
the
they're
whole
not
school or
infected.
having to quarantine.
Rather than closing the whole school or
We
having
can
to
keep our
quarantine.
K through 12 schools open.
We can keep our K
That's
through 12
exactly
schools
what we should be
open.
doing. That's exactly
So
what
folks,
we should
let
be
me
doing.
summarize.
We
So
should
folks,
all
let me
be concerned
summarize.
about Omicron.
We should all
but
be
not
concerned
panicked.
about Omicron. If you're
But
fully
not
vaccinated,
panicked.
and especially if
you
you're
got
fully
your booster
vaccinated,
shot,
and
you
especially
are
if you got your
highly
booster shot,
protected.
you are
If you're
highly
unvaccinated,
protected.
You're at a
If
higher
you're
risk of
unvaccinated,
getting severely ill from COVID-19,
you're at a higher risk of
getting
getting
hospitalized,
severely ill
and
from
even dying.
COVID-19, getting
So
hospitalized.
the best
and
thing to
even
do
dying.
is get fully vaccinated and
So
get
the
your
best
booster
thing to
shot.
do is get fully vaccinated
And
and
no,
get your booster
this
shot.
is not March of
And no,
2020.
this is not
200
March of
million
2020.
people are fully
200
vaccinated.
100 million people
We're
are
prepared.
fully vaccinated.
We know more.
We're
We just
prepared.
have to stay
We
focused.
know more.
We just have to stay
That's
focused.
where we stand. Now let me tell you
So
about
that's
the
where we
additional
stand.
steps.
Now, let me tell
ordering
you about the
today
additional
to take
steps
on
I'm
what is
ordering
coming. I know you've
today
heard a lot
to
of this
take
in the
on
news already.
what
this
is
week.
coming. I know you've heard a lot of this in the news already.
3
this
weeks
week.
ago,
I laid out a COVID-19
3 weeks
action
ago,
plan.
I
for
laid
this
out a
winter
COVID-19 action
that
plan
prepared us for this moment.
winter. That
Today,
prepared us for this moment.
We're making the plan even
Today,
stronger. We're making
First,
the plan even
we're
stronger.
setting up our vaccination
First,
and booster efforts.
We're setting up
stepping
our
it
vaccination and
significantly.
booster efforts.
In the
We're
past
stepping it
2
up
weeks, we've
significantly.
seen the highest
In the
vaccination
past
rates
2 weeks,
since
we've seen the
last
highest
spring.
vaccination rates since
And
last
we
spring.
aren't as vaccinated as a country.
And we
as
aren't as
should be, though.
vaccinated as a country.
That's
as we
why we
should
have
be,
added 10,000 new
That's why we
vaccination
have
sites.
added
on
10,000
top of
new
the
vaccination
80,000
sites.
sites that are
On top
already
of the
we already had in
80,000
place.
sites that are already we
And
already had
even
in
more
place.
will open in January. And even more will
I know
open
there's
in
some
January.
parts of this country where people are very
there's
eager
some
to get
parts
their
of this
booster.
country where people are
Where it's
very
harder
eager
to get an
their booster.
appointment. Excuse me.
It's harder to get an appointment.
So
Excuse me.
starting this week, I'll be
So
deploying
starting this
hundreds
week,
more vaccinators.
I'll be deploying
more
hundreds more
sites to help get
vaccinators
the booster shots
and
in
more
people's arms.
sites to help get the booster
I've
shots. in
ordered
people's
FEMA,
arms.
the Federal Emergency Management
I've
Agency,
ordered FEMA,
to
the Federal
stand up
Emergency
new
Management
pop-up
Agency,
vaccination clinics
to stand up
all
new
across the
pop-up
country.
vaccination clinics
where you can
all
get
across
that
the
booster
country.
shot. Where you can
We've
get
opened-
that booster shot.
Excuse me, we've opened
We've
FEMA
opened
vaccination sites in Washington
Excuse me,
State.
we've opened FEMA vaccination
Mexico.
sites in Washington State
recently
and New
as
Mexico.
cases have increased.
Recently,
And
as
today,
cases have
I'm directing
increased.
FEMA to stand
And
up new
today,
sites in areas
I'm
where
directing
there is
FEMA to stand
high
up new
demand.
sites in areas where there is a
These
high
steps are going
demand.
to help us add more.
These steps are going to
booster
help us add
appointments.
more
And over the-
more
just
more
over the next
booster
few
appointments.
weeks.
And over the
I also
just
want
over
to
the
say
next
a
few
word
weeks.
to parents.
I also want to say a word
If your
to
children are not
parents.
vaccinated, if your
Please
children
get
are
them
not
vaccinated.
vaccinated,
Please
if
get
you're a
them
parent,
vaccinated.
understandably, who waited,
If you're a
to
parent,
see
understandably, who
how the
waited
first shots went with
to
other
see
kids, how the
before
first
getting
shots
your own
went
kid
with other
vaccinated,
kids, you can stop
before
waiting.
getting your own kid vaccinated,
6 million
stop
children in our
waiting.
country, ages
6
5 to 11
million
are
children in our
vaccinated.
country, ages 5 to 11 are
Get
vaccinated.
your children protected today.
Get your children protected today.
For those parents out there who have a child,
For those parents out there who have a child
that is under the age of 5
to be vaccinated,
I know
that is
this
under
can
the age
still
of
be a
5.
scary time.
I know this can still
One
be a scary
thing-
time.
One thing you can and must do. One thing you
While
can
we
and
await
must
vaccines for children under 5,
While we await
get
vaccines for
yourself
children
fully
under 5,
vaccinated and
get
boosted,
yourself fully vaccinated,
as well as those
and boosted.
around you, your
As
children,
well as
your
those
caregivers,
around you,
your siblings, your children, your caregivers.
It's critical
your
to mask
siblings.
up in public indoor
It's
places.
critical to mask up in
We
public.
know that
indoor
our youngest
places.
children
We
have
know
only
that our
rarely
youngest
been
children
impacted by
have
serious
only
COVID
rarely
cases,
been impacted by
COVID-19
serious
cases.
COVID cases,
But they can be
COVID-19
further
cases.
protected
If they're
But
surrounded
they
by
can be further
vaccinated people.
if they're surrounded by
And
vaccinated
again, to
people.
folks who are not vaccinated. And
You
again,
may
to
think you're
folks who are
putting
not
only yourself
vaccinated.
at risk. You may think you're putting only yourself at
But
risk.
it's your choice.
Your choice
But
is
it's
not
your
just a
choice.
choice about you.
Your choice is
Affects
not
other
just
people.
a choice about you.
You're putting other
Affects
people
people
at risk. You're
Your
putting
loved
other
ones,
people
your
at risk.
friends, neighbors,
Your loved
strangers
ones,
you
your
run into.
friends,
Neighbors,
Your
strangers you
choice
run
can
into.
be the difference between life
And your
or
choice
death.
can be the difference between life
The
or
longer the
death.
virus is around, the
more
longer the
likely
virus is
variants
around,
form.
the more likely
It may be
variants
deadlier than
form.
the ones that have come before.
It may be deadlier than the
Let me
ones that
say
have come
again
before.
and again and again and again.
Let me say again and
Please
again and
get
again
vaccinated.
and again. Please get
It's the only
vaccinated.
responsible thing to do.
It's the only responsible
Those who are
thing
not
to do.
vaccinated are causing hospitals
Those
to
who are not vaccinated
overrun,
are causing
become overrun
hospitals to
again.
overrun,
I just
become
spoke to the
overrun
governor
again.
of New York.
I just spoke to the
Every
governor of New York.
COVID-19 hospital means someone.
Every
with a heart
COVID-19
attack,
hospital means
cancer, or
someone
other serious
with a
illness
heart attack,
may not
cancer,
get
or other
that
serious
bed
illness, and that
may not
life-saving
get
care
that
they need
bed
in the hospital.
and that life-saving care they need in
Look,
the
let me
hospital.
give it to you straight again.
Look, let me
Omicron
give
is
it to you straight
serious,
again.
potentially deadly
Omicron
business for
is serious,
unvaccinated
potentially
people.
deadly business for
Let me be clear.
unvaccinated people.
Thanks to the prior
Let me be clear.
administration and our scientific
Thanks to the
community,
prior
America is
administration
one
and
of
our
the first
scientific
countries to
community,
get the vaccine.
America is one of the first countries to
Thanks
get
to
the
my
vaccine.
administration and the hard work of America.
Thanks to my administration,
we led
and
a
the hard work of
rollout,
Americans,
made America among
we
the
led a
world
rollout,
leaders in getting
made
shots in
America among
arms.
the world leaders in getting
But
shots
uptake
in
slowed
arms.
this summer as
But uptake
vaccine
slowed this
resistance
summer
among some hardened.
as vaccine resistance among some hardened.
The unvaccinated are responsible
Look,
for their own
The
choices.
unvaccinated are responsible for their own
Those
choices.
choices have been fueled by dangerous
Those choices have been
misinformation on
fueled
cable
by
TV and
dangerous
social
misinformation on cable TV and social media.
You know, these companies and personalities are making money.
You know, these companies
by
and
peddling
personalities are
lies
making
and
money
allowing misinformation
by
that can
peddling
kill their own
lies and
customers
allowing
and their own
misinformation
supporters.
that can kill their own customers
It's
and their own
wrong.
supporters.
It's immoral.
It's wrong.
It's
I call on
immoral.
the purveyors of these lies and misinformation.
I call on
to
the
stop
purveyors
it.
of these lies and
Stop it
misinformation.
now.
Stop it.
Stop it now.
One of the other things that we know that has to be done.
One of the other things that we
more
know
testing
that has to be done.
because
more
Omicron
testing.
spreads easily.
Because Omicron
Especially among the
spreads
unvaccinated,
easily.
it's critically important that we
Especially
know
among the
who's
unvaccinated. It's
infected.
critically important that we know
That means we
who's
need more
infected.
testing.
That
On
means
that
we need
score,
more
we're
testing.
now where we should be.
On that score, we're
Yes,
now where
we
we
have over
should be.
20,000 free testing
Yes,
sites.
we have over 20,000
Yes,
free
we've
testing
used the
sites.
Defense Production Act
Yes,
and
we've
spent
used the
$3
Defense
billion
Production Act
and spent
greatly
$3
expand the
billion
number of
at-home tests available
greatly
for purchase
expand the number of
online
at-home tests
and at your
available
local
for
pharmacy.
purchase
Yes,
online and at
we
your
made
local
sure
pharmacy.
insurance
Yes,
covers the PCR
we
tests
made
you
sure
get in the
insurance
hospital or
covers
at
the
your doctor's
PCR
office.
tests you get in the
But
hospital. or at your
starting
doctor's
next
office.
month,
Private
starting
insurance
next
will
month,
also cover
private
at-home
insurance
testing.
will all cover also
So you
cover
can
at-home
order a
testing.
test online and get
So you
reimbursed.
can order a test online and get
providing
reimbursed.
access to free at-home tests for
We're
those
providing access
who
to
may
free
have
at-home tests
insurance
for
as
those
well,
who may not
who
have
may
insurance,
have
I should say,
insurance as well.
may not have
But it's
insurance,
not
I should
enough.
say, as well.
We have to do
But
more.
it's not enough.
We have to do better.
We have to do more.
And we will.
We have to do better.
Starting
And we
this
will.
week, the federal
Starting
government will
this
set up
week,
emergency testing
the
sites
federal government will set up
in areas that
emergency
need
testing
additional
sites
testing capacity.
in areas that need additional
Before
testing
Christmas,
capacity. The first several of these
Before
federal
Christmas,
testing sites will be
the
up and
first
running
several
in
of
New
these
York
federal
City.
testing sites will be up and
With
running
many
in
more
New
to
York
come.
City. With
This
many
free
more to
testing
come.
is going to help reduce the
This
waiting
free
lines.
testing is going to help
The
reduce
time you have
the
to stand
waiting
there.
lines.
And
The
sometimes
time
it's
you have to
hour
stand
more.
there.
And
We're
sometimes
going to
it's
continue to
hour
add
more.
federal testing sites.
We're going to
where
continue
needed.
to add federal
So that if
testing
you
sites
want an
where
immediate
needed.
test,
So that if
there'll be
you
a place
want
where
an
you can go
immediate
get it.
test,
there'll be a place
we
where
also
you can go
need to
get
do
it.
better with at-home testing.
We also need to do
I'm
better
announcing
with
today
at-home testing. The federal
So I'm
government will
announcing today
purchase
One
The
half
federal government
billion.
will purchase
That's not
one
million,
half
billion,
billion.
B. That's not
Additional
million,
at-home
billion,
rapid
B.
test. With
Additional
delivery
at-home
starting in
rapid
January.
test.
With delivery
We'll be
starting
getting
in
these tests to
January.
Americans for free.
We'll be getting these tests to Americans
We'll
for
have
free.
websites where you can get them delivered to
We'll
your
have
home.
websites where you can get them delivered
We've
to your
arranged
home.
for it to be easier for you to
We've
find
arranged
free
for it to be
COVID testing
easier for
site
you to
near
find
you
free
on
COVID
Google.
testing site near you on
Just
Google.
enter
COVID tests near me.
Just enter the Google
COVID
search
tests
bar.
near me.
And you can
The
find a
Google
number of
search
different
bar.
locations
And
nearby.
you can
where
find
you
a
can
number
get
of
tested.
different locations
We're
nearby.
going to continue
where
to
you can
use
get
the
tested.
Defense Production Act.
We're going to continue to
as we
use
did
the
earlier
earlier
this
Production
month,
Act
to make sure
as
we're
we did
producing
earlier
as
this
many
month,
tests, to
and
make
as
sure we're
quickly as
producing as
possible.
many tests and as quickly
bottom
as
line
possible.
is it's a lot
The
better
bottom
than it
line
was.
is
We're
it's a
taking
lot
even
better
more
than it
steps
was.
to make it easier to get
We're
tested.
taking even
and
more
get
steps
tested
to make
for
it
free.
easier to get tested.
Next,
get tested for free.
We're preparing hospitals for
Next,
what's coming.
we're preparing hospitals
Those
for what's
40
coming.
unvaccinated adults
Those 40
have a good chance
unvaccinated
of getting
adults
COVID-19.
have a good chance of
And
getting
some
COVID-19.
of you will get very sick.
And some of you will get
That'll
very
mean
sick.
hospitals are going to get extremely
That'll
stressed.
mean hospitals are going to get extremely stressed,
both in terms of
extremely
equipment,
stressed again,
as well as
both in terms of
personnel to
equipment,
care for those who get sick.
as well as personnel to care for
That's
those
why
who
my
get sick.
administration has
That's why
stockpiled
my
and
administration
prepositioned
millions of
has
gowns,
stockpiled and prepositioned
gloves,
millions of gowns,
masks, and
gloves,
ventilators.
you call it PPP,
Masks and ventilators. We're
We
ready
call
to
it
send them
PPP.
immediately to any state
We're
that
ready to
needs
send them
more. immediately to any
In
state
addition,
that
I've
needs
directed
more.
the Pentagon to mobilize.
In addition, I've
an
directed the
additional
Pentagon to
1,000
mobilize
troops
an additional
to be deployed
1,000 troops
to help staff local
to be
hospitals
deployed
and
to
expand
help staff
capacity.
local hospitals
That's
and
1,000
expand
military doctors,
That's
nurses, and medics.
1,000 military doctors.
We've already
nurses, and
started
medics.
moving military.
We've already
excuse me,
started
medical
moving military.
teams.
They've already
medical
landed in
teams.
Wisconsin, Indiana this week.
They've already landed in Wisconsin, Indiana.
This is on
this
top
week.
of 300 federal medical
This is
personnel
on top of
that are now on
300
the
federal
ground,
medical
having
personnel that are now
deployed
on the
since
ground,
we learned about Omicron.
having deployed since we
Look,
learned about Omicron.
While we know
Look,
staffing is the biggest need for
while we
hospitals,
know staffing is the biggest
some may
need
need
for
more
hospitals.
beds as well. Some may need more beds
We're
as well.
prepared.
I've directed FEMA to
We're
activate
prepared.
the National
I've
Response
directed
Center
FEMA to activate
begin
the National
deploying teams
Response
now,
Center
to
provide
begin
additional
deploying
hospital
teams
beds.
now, to
provide
begin to
additional
construct
hospital beds.
emergency capacities
We'll
near
begin to
hospitals,
construct emergency
parking
capacities
garages
near
and nearby
hospitals,
buildings to be
and
ready
parking
if
garages
needed.
and nearby buildings to be
And the
ready
federal-
if
the federal
needed.
government is paying for all of this.
And the federal
Period. All of
government
it.
is paying for all of this.
Further,
Period. All of it.
FEMA will
Further,
deploy hundreds of ambulances.
FEMA
and
will
EMS
deploy hundreds
crews
of ambulances.
so that if
and
one
EMS
hospital
crews,
fills up,
so
we
that
can
if
transport patients.
one
to
hospital
beds
fills
elsewhere.
up, we can transport patients
This week,
to beds elsewhere.
we'll send dozens
This
of
week,
ambulances to New York
We'll
and
send
Maine because
dozens of
because
ambulances
the
to
COVID
New
is
York and
spreading
Maine because the
rapidly.
COVID is spreading
to help transport
very
patients
rapidly.
To help
Our
transport
doctors,
patients.
nurses, hospital staffs,
Our
have
doctors,
gone above
nurses,
and beyond
hospital
during this
staffs
pandemic.
have gone above and
The
beyond.
strain and
during
stress
this
is
pandemic.
real. I really mean it.
The
It's
strain and
real.
stress is real. I really mean it.
We'll have
It's
their
real.
backs, though. We have to let them
We'll
know
have
we
their
have their
backs,
backs. We have to let them know we have
Finally,
their backs.
We're making sure the COVID-19
Finally,
no longer closes.
we're making sure the
businesses or schools.
COVID-19 no longer closes
Last week,
businesses or schools. The federal court
Last week,
reinstated my administration's
federal court
vaccination
reinstated
or
my
test.
administration's
Vaccination
vaccination
or
or
test
test
rule for businesses
vaccination
more
or
than
test
100
rule for
employees.
businesses
The
with
rule
more than
requires
100
employers with
employees.
100 or more employees
Rule
to
requires
protect their
employers
workers
with 100
or
or more
on-site
employees
to protect
and
their
indoors
workers with the
or
requirement
on-site
that they be
and
vaccinated
indoors with
the
the
requirement
tested
that they
each
be
week
vaccinated
or go
or
home.
tested
each week or
These
go
rules are going
home.
to keep workers safe and keep workers
These
safe.
rules
will
are going
help
to keep workers
businesses
safe and keep
open.
workers safe. Will help
People are
keep
vaccinated
businesses
or
open.
tested.
People
They're
are
much less
vaccinated
likely
or
to get
tested.
sick and less likely to spread
They're much
it to
less likely to
others.
get sick and less likely
Customers
to
are
spread
more
it to
likely to
others.
come in and shop.
Customers are more
because
likely
they know
to
it's
come
a
in
safe
and shop
environment.
because they know it's a
I know
safe
vaccination
environment.
requirements are unpopular.
I know vaccination requirements
For
are
many.
unpopular. They're not even popular for
For
those
many.
who are anxious to get
Not
them.
even popular for those who
My
are anxious
administration
to
has
get
put
them.
them in place not to control
My
your
administration
life,
has put
but
them
to
in place
save
not
your
to
life,
control your life, but to
and the lives
save
of
your
others.
life. We're
And the lives of
400,000 Americans died
We're
from COVID this
400,000
calendar
Americans
year.
died from COVID this
And almost
calendar
all
year.
were unvaccinated.
And
Almost
almost
all
all
were preventable.
were unvaccinated.
Almost all were preventable.
The rule is legal and effective.
It's
The
going to
rule is
save
legal and
thousands of
effective.
American lives.
It's going to save thousands
Must
of
also
American
keep our
lives.
K-12 schools open.
Must also keep
Look, the
our
science is
K-12
clear.
schools open. Look, the
And
science is
overwhelming.
clear. We know how to
And
keep our
overwhelming
kids safe
from COVID-19.
We know how to keep our kids safe.
from COVID-19.
K through 12 schools should be open.
K through 12 schools should be
And
open.
that safety is increased if schools require
safety
all
is
adults
increased if
who
schools
work in the
require
schools
all
to get
adults
vaccinated.
who work in the schools to get
And
vaccinated.
take the safety measure that the CDC is
And
recommending,
take the safety
including
measure
masking.
that the CDC is recommending, including
I got
masking.
Congress to pass billions
I
of
got
dollars
Congress
in
to pass
school
improvements,
billions of dollars
ventilation,
in
and
school
social
improvements.
improvements, ventilation, and
Schools
social
should be
distancing.
safer than ever.
Schools should be
from
safer
COVID-19.
than ever from
And
COVID-19.
just Friday, the CDC issued a test
just Friday,
to
the
stay
CDC issued
guideline.
a test to
So schools
stay
can stay
guideline.
open and kids can stay in
So
class.
schools
even
can
if a
stay open and
classmate
kids can stay
tests
in class,
positive.
even if a classmate tests
COVID-19 is scary, but the science is
COVID-19
clear.
is scary,
Children
but
are
the
safe
science
as
is clear.
as safe
Children
in
are
schools they
safe
already
as-
play.
as
Assuming
safe
the
in schools they
precautions
already
have been
play.
taken and they've
Assuming
already
the
been funded.
precautions have been taken and they've
Let me
already
close
been
with
funded.
this. I know
Let me
you're
close
tired.
with this.
I know
really
you're
mean
tired.
this, and I know you're frustrated.
I really mean this.
We
and
all
I know
want
you're
this to be
frustrated.
over. We all
We're
want this
still
to
in
be
it.
over.
And
We're
this is
still
a
in it.
critical moment. And this is a
We
critical
also have
moment.
more tools than we ever had before.
We also
We're
have more
ready.
tools than we ever had before.
We'll get through this.
We're ready.
We'll get through
As we
this.
head into the holidays.
I want
As
us
we head
to
into
all
the
keep
holidays.
the faith.
I want us to
I
all
want
keep
to
the
sincerely
faith.
thank you for your
I want to
perseverance,
sincerely
encourage you,
thank you
countless
for your
acts of
perseverance,
kindness,
your
love,
courage,
and
and
countless
sacrifice
acts of kindness during these
love
last
and
2 years.
sacrifice.
During these
Throughout our
last 2
history,
years,
we've been tested as a
throughout our
people
history,
and as a
we've
nation.
been tested as a people
Through war and
and as a
turmoil.
nation.
We had to
Through
ask
war
whether
and
we'd
turmoil.
be safe.
We
Whether
had to
we'd
ask
be
whether
okay.
we'd be safe,
Whether we
whether
get
we'd be
back
okay,
to who we are.
whether we get back
We've
to
always
who we
endured
are.
because remember there is no
We've
challenge
always endured
too
because
big for
remember
America.
there's no
I mean this
challenge
from
from
the
bottom
bottom
of
of
my
my
heart.
heart. No challenge. I mean this from the bottom of my heart.
We've
No
come
challenge.
through better and stronger. We've come
Because we
through
stay
better
together.
and stronger as the
Because we stay
United
together.
States of America.
As the United States of America.
That's what we have to keep doing today.
That's what we
We
have
can
to
do
keep
this
doing
together.
today.
I guarantee
We can
you.
do this together. May God bless
guarantee
you
you.
all. And may God,
God
bless
protect
you
our
all. And may
And
God protect our happy holidays. God love
And
you all. Happy holidays.
Mr. President, Mr. President, Mr. President,
On public health officials, we have to do better. Public health officials have been saying for months, this moment, is it a failure before just this adequate amount of tests? Failure, everyone to be able to get adequate amount of tests for everyone to be able to get
No, it's not.
one if they need
Because
one
COVID
right now.
No, it's not, because
spreading
COVID so rapidly,
is
you notice, spreading just so rapidly,
just happened
notice,
almost overnight.
just in the last
just
month.
happened almost overnight.
So
just in the last month.
So what, Mr. President, Mr. President,
So, no. So, no. But the alarm bell went off. I don't think anybody, the alarm bell went off. I don't think anybody, this was going to be anticipated rapidly. This was going to be as it did rapidly. And so the question is, we had a lot of people
And
who
so
have
the
access
question is, we had a lot of
to
people
tests,
who have access,
order them
to test,
could
have
order
their
them,
insurance
could,
paid for them, et cetera.
have
But
their
it all
insurance paid
sudden,
for
all
them,
of a
et
sudden,
cetera.
it was like,
But it
everybody
all
rushed to
all
the
of a sudden,
counter.
it was like,
It was a
everybody
big,
rushed
big
to the
rush.
counter.
And
It
I
was a
knew that
big,
was
big
coming,
rush.
so what I tried to
And
do
I
was
knew
meet
that
with
was
the company.
coming,
So what I
and
tried to do
use
was
the,
meet with the
companies
Defense Production Act
and
to
use
get
the
half a
Defense
billion
Production Act
more
to get
tests,
a
and
half
figure
a
out how to
billion
get them
more
to their
tests,
homes, and figure out how to get
on
them
the
to their
shelves
homes
in the store.
Get
I mean,
them
so
on the
that's
shelves
what it's all about.
in the
Yes.
store.
Mr. President, what's your message to Americans? Mr. President, what's your message to Americans who are not able to get tested and who are wondering what took so long to ramp up testing and who are wondering what took so long to ramp up testing? I'm hearing that from people who are trying to get tested now before the holidays. I'm hearing that from people who are trying to get tested now before the holidays.
It took so long, it didn't take long at all. Took so long, it didn't take long at all. The Omicron virus spread
Omicron
more
virus
rapidly than anybody
spread
thought. If I had
even
told
more
you
rapidly than anybody thought.
4 weeks ago,
If I had told
that
you
this would spread by
4 weeks
a
ago,
day-to-day
this
basis,
would spread by
it would
a
spread by
day-to-day
50, 100%,
basis,
200%,
it would
spread
spread
by
by
50, 100%,
I think you would have looked at me and said,
500%.
Biden, what are you drinking?
I think you would have looked at me and said,
that's what
Biden,
it
what are
did.
you drinking?
Now, we don't know what's
But
going to
that's what
happen
it
from
did.
here. Now,
Look,
we don't know what's
there's
going to
some
happen from
evidence
here.
that in South
Look,
Africa, where
there's some
a lot of
evidence
this
that in
started,
South Africa,
that it's
where
dropping off.
a lot of this
too. We don't
started,
know.
that it's dropping
But I
off.
do know
too. We don't know
that we're not going to be in a
But I
position,
do
like
know
I said, when we
that we're not
remember
going to
we
be
were
in a
having
position,
problem with,
like
like
I
I
said,
said,
when
gowns
we
and
remember
the
we
like.
were having problem with
I said, I
masks
promise
and
you.
gowns and
Remember
the
the
like.
criticism? I got
I said,
questions
I
from
promise
some of
you.
you.
Remember
Why
the
are you still
criticism? I
paying
got
for all
questions
these
from some
masks
of you.
and gowns?
Why
Why
are
are
you
you still
stockpiling
paying for all
this?
these masks and gowns? Why are you
Because we don't know.
stockpiling this?
Turns out we're going to need them.
Because we don't know.
In the back and
Turns
then
out we're going to need
in the back and then
Will you research work, sir, and will travel ban now that
I'm considering reversing. I'm going to talk with my team. I'm considering reversing. I'm going to talk with my team in the next couple days. Look, remember why I said we put the travel ban on. Remember why I said is to see how much time we had before it hit here, how much time we had before it hit here, so we looking at what's happening, what we needed by looking at what's happening in other countries. And so, but we're past that. Something that is being raised with me by the docs. Something that is being raised with me by the docs.
President, Mr. President, you hold you. President, Mr. President, you hold you.
You believe Senator Word protects trust. You believe Senator rebuild trust with progressives in your party. And how do you rebuild trust with progressives in your party to advance your legislation?
You know, I told you before. You've heard me say this before. You know, I told you before. You've heard me say this before. Think maybe I'm not Irish. Some people hold a grudge. Think maybe I'm not Irish. Look, I want to get things done. I still think there's a possibility. Look, I want to get things done. I still think there's a possibility. What I don't want to do is get it done. And Joe went on TV today, and Joe went on TV today. Not I'm told he was speaking to TV or not. I'm told he was speaking to said Joe Biden will caucus in the House and said Joe Biden. So look, I'm not looking for. And so look, I'm not looking. Let me say something. Let me say something. You saw what happened yesterday. You saw what happened yesterday. All the talk about how my Build Back Better plan was going to increase inflation. How my Build Back Better plan was going to increase inflation, going to cause debts and all. Goldman Sachs and others said if we don't pass Build Back Better, Goldman Sachs and others said if we don't pass Build Back Better, we're going to grow the economy. Without it, it's going to grow the economy. Without what happened, we're not going to grow. Stock prices went way down. What happened? Stock prices took a way down. Dip. Take a look. I wasn't. Everybody thinks because I quoted I wasn't. 17 Nobel laureates saying this is going to 17 Nobel laureates saying this is going to help inflation. You're a hard-working person. In terms of, and you're making 60 grand if you're alone, and you're making 60 grand if you're alone, making 80 grand alone, mom and dad 90, 80 grand, like a mom and dad 90 grand. You're worried about inflation. You should be worried about. And you're worried about inflation, you should be worried about working class. It's a devastating thing for people who are working class and middle class. Where is most of the cost now? Where is most of the cost? Gasoline. The cost is finding in gasoline, even though I put down 12 cents a gallon. We talked about the cost in food prices. We talked about what the cost in food prices going up, etc. Look what's in Build Back Better. Look what's in Build Back Better. Reduce it by up to 70%. You can reduce it by up to 70%. 20 million women who don't aren't back in the workforce being able to go back. Aren't back in the workforce being able to go back. We're talking about health care. We're talking about health care. We got 200,000 kids. In a system, we got type 1 diabetes. We got 200,000 kids with type 1 diabetes. You know what it's costing? It costs somewhere between 10 cents and $10 to come up with the formula. Somewhere between 10 cents and $10 to come up with the formula. Right? Okay? A while ago. You know what it's costing on average? You know what it's costing on average? $60, $640 a month. $60 up to $640 a month. Up to $1,000 a month. If you're mom and dad, if you're with minimum wage, dad, busting your neck, working with minimum wage, look at your kid, busting your neck, and you know if you don't get that vaccine for him, you know if you don't get that vaccine for him, get that drug for him. Excuse me, if you don't get that drug for him, if you don't get that, take that. What happens? Be able to take that. They're likely to go into a coma, maybe die. They're likely to go into a coma, maybe die. You strip away all the dignity. You strip away all the dignity. Looking at their child. I'm not joking about this. Looking at their child. Imagine being a parent. I'm not joking about this. Imagine being a parent. And you can't afford. Looking at a child. You have no house to borrow against. You have no house to borrow against. You have no savings. But all the things in that bill are going to reduce prices. Are going to reduce for middle class and working class people. For middle class and working class people. It's going to reduce. What's inflation? Having to pay more than the money you have because things have gone up. Having to pay more than the money you have because things have gone up. Costs across the board. Well, bring down all those costs across the board. Child care tax from child care to. But I'm not supposed to be having this press conference right now. I'm not supposed to be having this.
Mr. President, did Senator Manchin break his commitment? The White House says when you announced all 50 senators, the White House says that all 50 Democratic senators to get behind it. Did Senator Manchin break his commitment? So did Senator Manchin break his commitment to you?
Senator Manchin, I'm going to get something done. Thank you, Senator Manchin.
Ukraine, sir.